I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it. Welcome to this episode of IDD Health Matters. Our guest today is Andrew Kelly. Welcome, Andrew.
Thank you. Thank you so much.
So I always like to start with talking about how people got into the field of health services, supports, products, in this case, for people with intellectual and developmental disabilities. So tell us a little bit about your background.
Absolutely. Probably by mistake, like some folks, but
that's a common story. It was for me.
Yeah. So I came from the healthcare industry on the insurance side years ago for a managed care organization, and then kind of waded my way through, but I ended up working for a pharmacy that was owned by a large agency. And so interviewed for that position, found out what the agency did, didn't think much of it other than, I had an opportunity to work for a pharmacy. Since then, I've worked for 4 pharmacies that were specifically for IDD individuals. Part of the passion in that is that, these individuals are individuals who need help, they need guidance, and they need a quality of life. So it's really has been a journey, because I went from a pharmacy that was owned by an agency to a for-profit, back to an agency, and then back to a for-profit, and now I reside at a technology-based company.
So I want to talk more about the technology part of it that you're doing now, but I want to ask you a little bit about the pharmacy services part of it. What was that like? What did you do? What kind of services did you provide specifically?
Well, as you know, these individuals are under care, so they need very specific packaging. They need some hand holding. The DSPs need as much assistance in making sure, because, again, back to the DSP.
So they need support like everybody else. DSPs need support. I need support. We all need support at different times. So basically you supported people to be able to have the meds they need and to be able to take them in a way that works well for them. Is that
right? Right. So preparing it to make it easy, because DSPs, they have my heart, because not only are they cooking, cleaning, taking care of individuals, they're expected to be nurses, sometimes play doctor, and it's challenging. So the easier we could make it for them to actually administer the medications properly, because there's a lot of stress in that. There really is
a lot of responsibility.
So packaging was very important, integrating electronic medication administration records versus the paper, which makes it easier because you're integrating technology with scanners, and the pharmacies generally will provide that type of a service.
Yeah, that's important and needed for sure. Health, that relates so much to health and wellness, and if people don't have access to their medications, or it's complex to take them, or people who are working with them have trouble maybe figuring out what to do, that can impact a person's health, certainly. So the services that you provide in the pharmacy realm can help really improve people's lives, to say in a nutshell.
100%. And when you look at pharmacies that are specific to the IDD community or long-term care versus, we all want to use local businesses, mom and pops, but the technology is generally not there. The workflow is not there. The packaging is not there, but there's a lot of loyalty. And so that was, some of the challenges, but you knew you were doing it for the greater good.
Yeah. And that's something, in any aspect that people work in this field, there's a lot of a sense of I'm doing something that's helping other people. And there's a lot of satisfaction in any aspect of work in this field. So speaking of any aspect, you mentioned technology. So you're doing something else in this field now with iCare Manager, right?
Absolutely.
All right. So what is that about?
So iCare Manager is an enterprise solution for electronic health records. So ultimately, it's a documentation system at its core. So allowing organizations to document from the individuals, what's going on in their lives, their care plans, to passing those meds properly, accurately, all the way to a realm where you wouldn't think it would be an electronic health record, to managing the fleet, because these large agencies have tens, 20s, 30s, hundreds of cars, vehicles that they need to keep running properly for the individuals that they serve. the maintenance of the home. So we actually have built modules to support that. And it was out of response to our customers who would come to us and say, hey, can you do anything to help us here? And our founders are very reactive and listen to this industry. That's why they've been so successful, that they say, give us 6 weeks, we'll see what we can do. And they would deliver a module. It may not be what it is today because they continue to build on it, but very reactive because we don't want anyone having to go outside of the system. We want it to kind of be their central portal to wherever they need to go to service the individuals that they serve.
So you talked about documentation, and one of the things that we always said in medicine is if it's not documented, it didn't happen.
And the legal industry.
Yes, yeah, and in really most industries, really. And so, but it is so important to document all of these aspects of things, and sometimes, especially, I'm always thinking about healthcare, so it's always documentation of healthcare services and all of that. But there's so many other things that really need to be documented. You mentioned, keeping track of automobiles and all of that, and that's really neat that you guys listen to what the needs are out there, and then you respond and you produce something that works for them, and that's I'm sure very valuable to the people that you work with.
I think so. I think the feedback we get, we don't lose customers. I mean, really, and that's a testimony to, do we make mistakes? Of course, we all make mistakes. However,
we're just not admitting it, right?
Exactly. and it's a funny story. So when way back with my pharmacy days, I had actually introduced the electronic medication administration record to some agencies and brought a company in, which was not the company. We weren't even in existence at that point. And the feedback we got was, we're going to stop using it because it's causing us to have all these errors. And I had to put a kind of a spotlight on that, saying those errors were there before.
Right.
Now you're seeing them, because traditional R's, you're putting initials in small boxes, and you could do that today, tomorrow, or the next week, and you can backdate. So it was an educational process. Now how we're going to integrate some teaching or some education to make that better. You're just putting a spotlight on something you didn't know about.
That's right. And in an indirect way, it's helping to improve the system, of supports and services in a better way. So in your platform, how are health related things documented? Now, it's not the physician that's seeing the person that's really documenting in your system, or is it?
Correct. It is not.
Okay.
It's the DSPs, it's the nursing. And so what it is it's documenting what they do daily. It also allows them an opportunity for physician order forms to be generated to take to the physician, and it's documenting what has happened day to day, week to week, month to month, in between those visits. Something as simple as daily blood pressure readings. You as a physician, you didn't have access to that necessarily, right, especially if you were a generalist private practice. So this allows them to have this type of historic blood glucose. Same thing. It's great. You see it, you take it. It's one time. It's a snapshot. This gives the horizon. And we do in our system give access. They can give access to their physicians and to our pharmacy portal. The pharmacy has real-time access into the system as well.
Nice. I'm going to ask you a specific question. Okay. Can people document seizures?
100%.
Okay.
And then there's a great interest in that, because in this industry, we know that that's problematic. It's very common. It's too common, in fact.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, my ability is stronger than my disability. We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support. Yeah, one of the things that I talk about when I do, training about various issues, and when I'm speaking about seizures, I talk about the importance of having an accurate seizure record. And it needs to be more than just a check off, oh, this person had a seizure. It needs to talk about, well, what did the seizure look like? How long did it last? How was the person after the seizure? Were they sleepy? Were they groggy? How long did that period last? Because that type of information is huge in terms of decision making from a clinician standpoint in determining, is this medicine working? Is it having a benefit? Do they need to be changed to a different medication? And so that having accurate documentation for anything, but in particular for seizures, is so valuable. When you think about it, if someone goes to see a neurologist for a seizure evaluation, and maybe they have a supporter with them, and the supporter is asked, well, how is the person having how have their seizures been? And the answer is, well, they've been having a lot more than normal. Versus if they say, here's the record and here's the times and the dates and how long they last and so on and so forth, that really empowers the clinician to have that information to make better decisions. Sometimes it's challenging for people to get access to healthcare from clinicians who understand their needs and all, but we can do things on the provider side to help improve those clinician interactions as well too. And that's a perfect example of it is really bringing helpful and pertinent information, blood sugar records, all of those things. It makes it so much easier for the clinician to make a good decision or well-informed decision, and again result in a better outcome. And the idea is that people live more full lives, less burdened by preventable health issues. So certainly a lot of value in what you do and how you do it. So that's good stuff. So one of the things I like to do, we talk about various careers here and different ways people can work in this field and the various opportunities. And so you're bringing a perspective of working in the field, providing tools for other people to help them do their jobs well. I like to do a little thing I call 3 and 3. It's three pieces of advice, I guess, in 3 minutes. So do you have 3, 2, 1, whatever you want to say, things that you would like to tell our listeners about this field, working in this field, some advice if they want to get into this field, anything you want to talk about?
Certainly. So the one thing I would bring up is, and someone, no matter what industry you're in, someone always says this, but I genuinely believe this: there's amazing people in this industry. They care about people. Because a lot of times there's not no other benefit than just caring for people. So, these individuals, there's a reflection there that's just amazing. So I think it's just a rewarding from that perspective, because you meet great people. The people in this industry. I think it's an explosive industry from a perspective of it's continuing to grow, because the more and more we identify what this industry is. Before it was very niche, it was very, very niche. Now we realize there's some things that they're outliers that need attention to increase the quality of life of an individual. That before it was just it was kind of dismissed, overlooked. Now it's identified, and so I think it's an industry where we can be impactful in lives. I think with being impactful in people's lives, it becomes fulfilling as well. So I think individuals looking at opportunities. It's a growth industry. It's not one that you see on the news as a growth industry. Right. You see all other things. I think it's the hidden gem, and there's growth personally, professionally. And I think it just emits from you when you're in this industry, just a love.
So a lot of personal satisfaction in this field, a lot of potential for that, for sure.
And hard work.
Yeah. And hard work.
And hard work. I mean, the people who give care in this industry have all high respect. They don't just have one job.
That is true. Lots of different aspects of it, sure. Well, Andrew, thank you so much for bebeing a part of the podcast, joining us today, and for the work that you do in the field.
My pleasure.